I'm Chrystal Benson. I'm the clinical nurse specialist in dual diagnosis here at Banyan House. Banyan House is a drug and alcohol rehabilitation centre, so it's a residential centre. ICE is a very powerful grip on people. It allows people to feel fabulous. It allows them to feel like things are just going so well until they've used for so long and they haven't slept and they haven't had that rest the body needs. And then they find that they are having that, issues of psychosis and not coping well, falling apart. For those people, that's maybe the time to keep them safe. When they've come down off that, they're thinking about it, then we need to have the services to provide them to think about, well, what would they like their life to look like if they weren't using ICE, and how did they get those tools in place? And then where do they go to next? For people who have been using ICE and want to come off ICE, it's very important that they be ready to do that. Sometimes they end up at the ED in a medical crisis. They might have psychosis at that point in time. They might not be functioning so well. It's important, though, that they be given the opportunity to link in through the hospital services of alcohol and other drugs. If they're ready, then it's terrific. They can be assessed by a rehabilitation centre like Banyan House. They may need to detox in that period of time coming in. They may have been awake for long periods of time, so their body needs that absolute rest when they crash down. And so they can come here to Banyan House for 1 to 2 weeks. Then they might look at the program during that period of time, start to move into the program and look at what's going on and see whether it's for them. And in that, then what we do is we look at providing some structures, some routines for them, support in terms of what's going on with their psychological health, so they can access our psychologist. We do group therapy, so it allows them to talk about their experiences with other residents. We look at relapse prevention for them, so that they could look at what their triggers are for using drugs. We like to work on strengths-based, so they start off with things that they do well, so they can work on where their vulnerabilities are and what they need to put in place to support them for that. We can do therapy with families here, and we certainly encourage them when they leave here to access those services as well. Things like Relationships Australia, Amity Counselling Services, NA or AA if that's appropriate. Sometimes people will have multiple issues in terms of drugs and alcohol. It might not just be ICE. So we look at those sorts of things to provide support. It's a particularly difficult drug in that it will change aspects of their brain, and it takes a while to get themselves back into functioning as well as they might have before by re-establishing those routines. Redeveloping those pathways in their brain that function well for them. It's a purer form these days that we see with ICE, so it's more addictive, and it can get out of control for people a lot more easily than it might have if they've used other drugs in the past and been able to manage that drug use while going on and living their lives. This one tends to get away from them, and they find that it impacts their work, their family life. Everything starts to really fall apart, and that's when they need those services and they need that assistance to detox, and they need to re-establish those structures in their life that help them build that life back up again. For people that are using ICE and are not ready to come off ICE, they may be thinking about it, they might want more information. Certainly counselling services would be a great step for them, so something like Amity, counselling services, Narcotics Anonymous might be an avenue for them to be able to go and speak to. For family members, it might be that through Carers Inc. they can look at the ICE support group which is there to be able to get that information that they need to understand what's going on. There's nothing worse than not knowing what's happening next, what's the process, where do I need to go to now, that somebody's now come into that frame of mind where they do want to change. Where do you go to next? And working through that ambivalence sometimes of people. For people who are perhaps not ready, look in counselling services like Amity Counselling, Narcotics Anonymous, and talk to them perhaps even through the GP, to a psychologist, through a mental health care plan, and look at whether they want to start working on why there's something that's holding them up about that change in their life. and investigating that. But ultimately, when people come into rehabilitation services, they need to be ready for that change in their life.